If your child is on medication for ADHD, you may have heard of a medication vacation or a drug holiday. Now, what this means is taking a break from their usual medication, whether for a few weeks, few days, or a few months. Sounds simple enough, but deciding whether this is right for your child, that's a different story. This is Parenting Behavior, and I'm your host, Dr. Andy Kahn. I'm a parent and licensed psychologist with over 20 years experience working with kids and families. Today, I'm joined again by Dr. Liz Harstad. Liz, how are you today?
I'm great. Thanks for having me.
Liz is a developmental behavioral pediatrician at Boston Children's Hospital and an associate professor at Harvard Medical School. She's been caring for children with learning and attention differences and developmental conditions for more than 15 years. And today, she's going to talk to us about medication vacations. Before we jump into things today, I want to say that we are not here to provide medical advice. Our aim is to provide high-quality information to help you learn more about ADHD medications and to feel better prepared to ask your own provider about these pieces of information. Our aim is to provide high-quality information to help you learn more about ADHD medications and to feel prepared to ask good questions with your child's provider. Please don't make any changes to your child's current medications or treatment plan without consulting with your doctor or medical provider. All right, Liz, let's go into a few questions here today. Now, what are some of the reasons why someone would consider taking a medication vacation or holiday?
Sure. Well, generally with stimulant medications, we do recommend consistent use of the medicine, as long as it's a medicine that is working to reduce ADHD symptoms and is fairly minimum side effects. Sometimes, in talking with the child's healthcare provider, a decision will be made to take a break from the medicine, perhaps to see if the medicine is still effective and needed for the child, or in situations where the best fit medicine is still associated with some side effects that we want to limit with having the medicine not be taken on a weekend or in the summer.
Gotcha. Now, I know that clinicians' understanding of medication vacations has sort of evolved over the years because of the scientific findings. Previously, breaks from ADHD medication were thought to be a good thing, especially during summer. But now it seems to be a bit more hazy. Can you tell us about how things have changed and why?
Sure. Well, in the past decade or so, there's been more and more research that just shows all the different ways that ADHD can impact a child. So we've known for a long time that ADHD can impact a child's learning and school performance. We now also know that it could impact a child's self-esteem, social interactions, safety. An example is, where do they choose to cross the street? Do they use a crosswalk or bolt across the street? And so with that knowledge, we want kids to do the best they can every day of the week, not just on school days.
So if people are going to try a medication vacation, is there a typical length of a break that people would be using for their kids?
Well, it generally depends why we're deciding to take a break from the medicine. With stimulant medications, they are medicines that work quickly in your system and then wear off after a number of hours, depending on which medicine is being used. And so just a day or two without the medicine can help us to know, are these ADHD symptoms still impacting a child, or does it seem as though they're not impacting a child as much as they used to, and maybe we want to reconsider the need of medicine.
Gotcha. So the idea of the stimulants having this short half-life gives us the advantage of being able to see pretty quickly what's happening. Okay, Awesome. Now, what are some of the risks of going off medication and then starting it up again?
Well, as I said before, we know that ADHD symptoms can impact a child every day, not just on school days. And there are real safety risks of having significant impulsivity, hyperactive behaviors, distractibility. I mentioned the example of crossing the street. For adolescents, there are concerns about safety in driving and risk-taking behaviors. For younger children, there could be risks that if ADHD symptoms are not treated, that may negatively impact their social interactions, ability to function in the family setting or in extracurriculars. For each child, this is an individual risk-benefit, but I think there are real risks of having the untreated ADHD symptoms if we know that a medication could reduce those symptoms.
Gotcha. So in terms of the symptom management, obviously that's really important. Are there any medical impacts or any physiological impacts of going off the medication for periods of time and coming back on it?
That's a great question. For most people, they will tolerate or kind of not really notice a significant difference of stopping the medicine and then going back on it. Kids that are sensitive to some of the side effects of the medicines may re-experience them again if they've been off the medicine and are starting it up anew.
What types of children might benefit most from having a medication vacation?
Well, that's always an individualized decision that should be discussed with your child's healthcare provider. But situations in which I've commonly worked with a family to talk about a break from medication may involve a situation in which we want to give some time without the medicine to see if the child's ADHD symptoms are still persisting and still warrant treatment, or a situation in which the best fit medication for that child is still associated with some side effects, perhaps decreased appetite and trouble with weight gain. And so having a few days, whether weekend days or summer days, without the medication allows the child to be free from those side effects.
That's so helpful. So if someone's interested in some of the benefits that could come from a medication vacation, but they don't necessarily want to take a break from the meds themselves, what other options are available to them?
Well, keeping in mind how quickly the medicines work and how quickly they get out of your system, we do have, for most kids, a few hours of time at least each day where we're seeing how they're functioning without the medicine. So if we're wondering how helpful the medicine is, and it's an 8-hour, lasting medicine, we may want to look at how they're doing later in the evening when the medicine wears off. So if the question is really looking at how helpful the medicine is, without missing a day of the medicine, we still probably have some time where we can monitor that.
So parents gathering that data sort of behaviorally to know what that looks like throughout the day for their child is helping them better collect information to help them make good decisions, it sounds like.
Absolutely.
Okay, gotcha. Liz, thank you so much for joining us and sharing your expertise. And thank you for joining us on parenting behavior. Don't forget to check out the show notes for the resources and links on topics shared in today's episode.